My name is Professor Macharia. I have been practicing ENT for the last 27 years. I have special interest in ENT, in various areas of ENT, including pediatric ENT, that is ENT diseases in children, snoring and sleep disorders, allergy in ENT, diseases of the voice box, and head and neck cancer, and also recently I'm involved in cochlear implantation. First, maybe we describe what is the larynx, because then you would understand what is cancer of the larynx. The larynx is that part of the body that comprises the voice box and the areas surrounding the voice box. So when you talk about cancer of the larynx, is cancer or growths that occur either in the voice box or the area immediately around the voice box. The major risk factors for cancer of the larynx are smoking, excessive alcohol intake, and it has also recently come to light that persistent acid coming up from the stomach to the throat may promote the occurrence of cancer of the larynx, what we call acid reflux, because there are people who don't smoke or don't take alcohol, yet they develop this. It's a constant irritation, whatever the cause of that irritation. So, smoking irritates constantly. Acid coming from the stomach may also irritate constantly, although it's a minor cause. But cigarette smoking is the major risk factor. The common symptoms of the cancer of the larynx include change in voice, what we call hoarseness of voice, persistent clearing of the throat, especially, or coughing, which may sometimes occur with expectoration of blood-stained sputum, and then progressive difficulty in breathing. That somebody will find that they are progressively finding it difficult to breathe, and the noisy breathing. So when they are breathing, they are making a noise. And but the major symptoms are change in the voice. Some in advanced cancer of the larynx, sometimes you may have problems in swallowing. So you have difficulties in swallowing, you find that swallowing is difficult. Most of the times this means that the cancer may be growing out of the larynx and is growing towards what we'd call the esophagus, that is where the food passes through. From the mouth to the stomach. The diagnosis of cancer of the larynx is based, one, on symptoms, the ones that we have already mentioned. Two, examination of the larynx, which can be done by the doctor in the clinic. There's a special examination of the larynx, which we call video laryngoscopy, is where the doctor uses a small camera that is put behind the tongue in the clinic and is able to look at the larynx directly. Therefore, the doctor will be able to see the swelling and take a picture of it. Then after that, the patient may be taken to theater most of the times, because very few patients are we able to take a biopsy in the clinic from the larynx. In theater, a biopsy is taken and then sent to the laboratory. The results of that biopsy are what confirms what type of cancer of the larynx. Because although we talk about cancer of the larynx, there are various types of cancer of the larynx. Once the diagnosis is confirmed, depending on the stage of the cancer, again, during the examination, both in the clinic and in theater, and in addition to special X-rays, CT scans, and MRI, the doctor is able to stage the cancer, so that we have either stage 1, stage 2, stage 3, or stage 4 cancer. Depending on the stage of cancer, the treatment, early stage cancer that is stage 1 and 2. Treatment is usually by surgery, and these days that can be done with laser surgery. And this may be all that is required, that if the doctor is able to remove all the swelling completely, then the patient may not need any further treatment. Apart from regular follow-up, because sometimes it can come back. If the cancer is advanced, stage 3 and 4, there may be a combination of surgery followed by radiotherapy and chemotherapy. Now, there are also times when, instead of surgery, radiotherapy alone is used for early stage cancer of the larynx. But the 3 modalities of treatment for cancer of the larynx is surgery, radiotherapy, and chemotherapy. Majority of patients will require radiotherapy, whichever the modality is. Radiotherapy is a very important part of the treatment modality, either after surgery or radiotherapy alone. In the very advanced, advanced cancer of the larynx, surgery may involve removal of the whole of the voice box, what we call total laryngectomy. Total laryngectomy means that the tumor usually will be late stage 3 and stage 4. And it means that the tumor has not spread outside the larynx. It is still confined within the larynx. And then the total removal followed by radiotherapy for majority of cases. There is what is called partial removal or complete removal. If it is complete removal, it means that we have to have a different, to create a passage for breathing, which is created in the neck. We create a hole that connects from the external environment to the air pipe, which is called the trachea, and then to the lungs. And that is a permanent creation. There are 2 primary methods of communication after removal of the voice box. One is what we call esophageal speech, that there are some people who are able to learn to speak by swallowing air, and then they produce sound that way. And esophageal speech, about 20 to 30% of patients who undergo total laryngectomy may be able to communicate just with esophageal speech. To develop a good esophageal speech, you need a good speech therapist who will teach the patient how to swallow in air and then produce sound. But since not everybody is able to develop an esophageal speech, majority of people will either use what is called an electronic larynx. That is an electronic gadget that you put on your neck, and it produces a robotic voice. The other way that you can communicate is to have what we call a voice prosthesis. And the voice prosthesis is a special valve that is put to connect the air pipe, the trachea, and the esophagus. Again, so that when you want to talk, you'll close the hole that you breathe through, and air will be directed into the esophagus, and you produce speech. Now, the voice prosthesis is currently the most used method of speech after total laryngectomy. The major problem with the voice prosthesis is it has to be changed regularly, for some people every 4 to 6 months, and so it is a recurrent expenditure. The advantage of the electronic larynx is that you buy it once, and the only thing you need to put is batteries from time to time. For a patient who has had a diagnosis of cancer of the larynx and has had treatment, it is important that this patient, whatever modality of treatment a patient has had, it's important that this patient is followed up. For the early stage cancer and even some stage 3 cancer, there is a practice which is called voice conservation. Voice conservation is that whatever treatment is used, you try and conserve the voice because of communication. Now, because of wanting to conserve the voice, then the treatment is less radical. For example, you want to conserve the voice box. So if you do either partial radiectomy or you do radiotherapy, it is important that this patient is followed up regularly for a lifetime, for his lifetime, because there is a few patients where this cancer can occur. And if, for example, the first treatment was radiotherapy and the cancer recurs, then most likely this patient will need surgery, because it's very rare that we repeat radiotherapy, unless the dose that was given during the first treatment was not the maximum dose allowable.